Hi, I'm Nazanine Khairkhah. I have been a nephrologist and an internist practicing both specialties in over 20 years. I have been in Greenwich, Connecticut since 2005, practicing in private practice.
Dr. Khairkhah, what
Yes.
were some of the biggest issues that you were facing before you started using Viscrow Scribe?
So back in 2012, as many of my colleague physicians may know, we were all forced in by laws that we had to go into an electronic-based system. And I'm always been more a paper and pen person. So of course with that force, we had to go in and comply, which is fine. But soon after I found out that I am not able to keep up with all the notes. If I see a patient, again, I'm more of a people person. I like to hear more. There's a lot more content to a visit. It's not just a one issue visit. And then I needed to run to the next room, to the next patient, and so on and so forth. At the end of the day, I would look at all these 20, 30, 35 to 40 notes, have left open without any details. And I would try to sit down, sometimes labor, late at night, sleepless nights, finishing. But soon it became evident that I cannot finish the notes of the same day and the same evening. So eventually I ended up with a pile of notes that would go on weeks to months after it. Then I had to sit down and try to remember what was the content of each of the visits, which was quite cumbersome. And so that was really my challenges.
I see. What was your first impression when you started using Viscrow Scribe?
A big wow. Honestly, a big wow. I've never seen something like this. I know this is a world of AIs and softwares and things like this, but this one particular software, I cannot say enough about it. And for many reasons. First of all, the first patient that was done, and it was like an example patient, and I went back and looked at the notes. They were bullets, they were summarized, they were treatments and assessment, and every little thing that I had talked to the patient that I didn't even remember, it would be right there in the note. I was just shocked, and my note looked so comprehensive. It looked like somebody sat there, or that I hired a scribe, which these days we know that they're not, that cheap either. And that, and then you have kind of, unfortunately, company of a human being standing in the room. Sometimes that does not make the patient very comfortable. So this was incredible. It was a big wow. That's all I can say. I was just so happy, ecstatic.
What benefits have you seen since using Viscrow Scribe in your practice?
Well, that's really easy peasy to say. First of all, I get to sleep at night, which is incredible because every human being needs a little sleep, so no more sleep deprivation. Second of all, my notes are so comprehensive and so detailed and so well organized with all these bullet points, as I said, so I can be all over the place. I can start with a patient, for example, with kidney disease and talk about their hypertension, and maybe this patient has come in with their spouse, and now the spouse intercepts and throws some stuff in the middle. And then we go on to talk about kidney and physiology. Then we come back again to the hypertension, but then we kind of get straight away from the hypertension, and we go on to say, oh, by the way, well, what do you think the hair loss has anything to do with the kidney disease? So we go talk a little bit about the hair loss, but again, at the end, we come back to the hypertension. This system, this software, brings everything about hypertension together in one bullet, and then gives a summary about hypertension, very concise. And then not only I walk away with a comprehensive note, my patient immediately has access to this comprehensive note. If I need to get a printout and give it to the patient to take it for a referral, everything is just right there at ease within seconds without that much effort.
And finally, would you recommend Viscrow Scribe to other physicians?
Oh my God, like if any of my colleague physicians or any other physicians does not take advantage of using of this software, you are at a loss. Honestly, I mean it. This I will go without any reservation. I absolutely recommend this software to all of the practicing physicians.
Thank you for your input.
You're welcome.